my normal hair not growing after hair transplant? I had my hair transplant done just over 2 months ago. I had the front and my crown done. My hair looks worse now than before. It looks like I have less hair. Do any of you know what's going on? You can see in my picture that I had more hair before, especially in the front. The hair transplant is made at Istanbul Hair Center. I'm still numb in the frontal area after the operation.
Thank you for your question. You had a hair transplant 2 months ago at a hair center, and you are concerned that you have less hair than you did before your transplant. Now, this is something that there's a good likelihood that you had a discussion with during your consultation. I'll explain what the basis is. When you have a hair transplant, you're moving hairs from your permanent zone behind in the back of the head to the areas which need hair, which is thinning out. Now, when that happens, the hair grafts initially will take, and then they go through a phase called shock loss. Now, this is a time when people will often panic because they feel like they're losing their grafts. And so we explain to our patients that shock loss is a normal phenomena, and we actually have a strategy for that, and I'll discuss that momentarily. In addition, the trauma of having surgery to existing hair in the adjacent area, which are native hairs, can also cause shock loss. So you combine the two, and then you end up with an area that looks like there's going to be no growth. Now, shock loss is temporary, and what you have to basically do is wait for the hair growth cycles to kind of synchronize and to start growing again over the course of several months. No matter what we do, we tell our patients that you're closer to your final long-term result is at about 1 year. Now, understanding hair transplant as being the moving of permanent hairs to an area where hair is thinning, there are some factors that are part of the equation of the long-term viability of the hair transplant. And that includes actual take of the grafts to the area that was transplanted. So let's say you moved 100 hairs. Over the standard hair transplant, it's not likely that you will get all 100 hairs there. You can get 5% loss, you can get a few hairs, you can get almost 90% loss. There's a range there. Now, when we perform hair restoration surgery, we actually have developed a system called hair regeneration, where we use a material called acellular matrix and combine it with platelet-rich plasma and vitamin D. And we have been successful in helping people with better take or better growth rates with the hair transplants, because it seems that this extracellular matrix wound healing technology accelerates the healing and reduces some of that initial shock loss or long-term loss based on the viability of the hair grafts. In addition, the hairs that are thinning will actually become thicker. So the combined benefit has been truly wonderful. We have had many patients who have come to us from all over the world who had a transplant, then learned about our hair regeneration, and then came to us to have the injection to help support their transplant. So it's something that people have done. Usually they'll do that in within the first month after their transplant. Again, this is not about our procedure, but it's to help you understand that wound healing is the key aspect of understanding what you're going through. So a normal process of wound healing does involve shedding of the transplanted hair and shedding of the existing hair, and sometimes that's referred to as shock loss. Nonetheless, patience, and you could try using some minoxidil and other, and even Propecia, I should say, finasteride, to help slow down your progression. But again, this is something that is more about your communication with your surgeon who performed the transplant, or at least communicating with the office and the technicians or the support staff. So again, to summarize, this is normal to lose a good amount of hair early on, and it is likely in most transplant situations that the existing hair will grow back and the transplanted hair will grow, and that you'll have at least close to the result that you were going for. So I wish you the best of luck. I hope that was helpful, and thank you for your question.